you're ready, we can go ahead and get started. We are rolling on our end.
Okay, perfect.
I'm told you want to make a statement off the top.
Yeah, let me just make sure everything's on silent. But yeah, I think we're good to go. Yes, well, so I'm calling in from home. I'm self-quarantining. One of my staff members came back positive, and I feel just fine. There's plenty of work still to be done, so we're doing it from home. And I know I'm just one of many people who are finding themselves in this position, folks who are testing positive, who have come into contact with folks who've tested positive. And we're seeing that not only in the testing side of things, but of course, hospitalizations. And so I continue to ask folks to stay home, to recognize that we're in a very, very dangerous situation, and we need the community to buckle down and take precautions. But we will keep fighting and working to find any opening we have to keep our community safe, and we need folks to do the same.
So Judge, you touched on it a little bit there, but how do you feel now to be in this situation that you find yourself in now, having to quarantine as well as a precaution, having to go through what a lot of people in our community are going through because of a possible exposure?
You know, it's something that reminds us that this virus doesn't spare anybody. As we know, it spreads through close contact. We know that there's no vaccine, no treatment, no cure right now that is widely available. And so we have to be very realistic about how we deal with the virus, because just like I can be exposed, all of us can be exposed. It's what's happening just as folks started having more and more contacts. And so we have to be very real about the situation. And that's why I've been calling also for an end to wishful thinking. We can't wish this virus away. Hope is not a strategy. And I'm here because I was exposed. Let's hope we don't come back positive. I just had the test done earlier today. But it should be a reminder for everybody that we know how the virus works. It's not making exceptions just because we're having fun, or just because we're, at church, or just because we want to be, different than other communities. The virus continues to be there, and that means that we have to be very, very, very careful.
How are you feeling personally, and how is your staff member doing, the one actually with the positive case?
The staff member is doing all right. I checked in with them just yesterday, and they said they're feeling a little bit better, but we have to keep watching and see. I know folks will feel great one minute, and then the next second, not so good. As far as myself, I am feeling great. Don't feel anything different. Feel strong and have plenty of work to do. I've had a lot of people send me messages, I'm so glad you're resting, and resting is the last thing I'm doing, but we've got too much work left to do.
Can you walk us through how the county is doing today in terms of coronavirus, in terms of numbers, what we're seeing, and if you've seen any change, whether good or bad, since Friday?
We are still watching those hospitalization numbers very, very carefully, and we still see an acceleration in the hospitalizations. The trend is growing. It is not growing linearly. It's growing, it's speeding up, and that's why on Friday we put the county on red alert. We need to recognize that sooner or later we're gonna have to take this step. And if we do it now, we might avoid the worst of it. The point is not to see whether we can get to a place where we're importing nurses and doctors, and we are cutting back on our general population beds so we can have ICU beds, and we're putting beds in the hallway, and we're having to activate our emergency medical shelter. That's not a smart strategy. It's not a sustainable strategy. It's not good for the economy, and it's not a compassionate strategy. So things are looking worse, not better, than they did on Friday. One place where we're seeing a very sharp change as well is testing. It used to be that our county test allotments each day. Folks can go online to readyharris.org and they can sign up for a free test. And normally those signups take a few hours to fill, sometimes 8 hours. These days they're filling in 45 minutes. 30 minutes. A lot of people wanting to get tested, people coming back positive, and as we see, the number of folks who have the virus is growing, and of course the hospitalization numbers, which just don't lie, because testing, you can say, well, we tested a nursing home, we're testing at the jail, more people suddenly want to get tested. But if someone needs to go to the hospital, they're going to go to the hospital. And we continue to see those very, very alarming trends, which is why it is time to stay home and to buckle down in order to both avoid the worst of this and also to move past it and come out the other side in a way that this second time around we can do it better than the first time and put our community in a position to succeed.
Do you see the public will there to actually stay home and heed your recommendations right now? Have you noticed a change in behavior among people after you took us to red alert and enacted that new phase in this fight?
I've noticed some change. I'm very heartened by the community recognizing that we have to take steps. Now, the concern is, I know it doesn't have as much of an impact if it's a recommendation as opposed to a requirement. And that's not a knock on the community, on the residents. We all live in a society where things that you really need to do, they're required. You have to wear a seatbelt. You cannot park in a handicap spot. You'll be fined if you do that. Now, that doesn't mean that if we had an enforcement provision as we've had in the past, that we would be out there trying to see how many fines we can collect or trying to put a police officer in every street corner. But it's important to have that enforcement provision because it sends that signal to the community about how important this is. And, as I said before, we're doing this with one hand tied behind our backs because it is an ask. And so it's harder for that message to get across, but we don't have another option. We know how long it takes us to flatten the curve. We know how much time we have. And even if, some folks are saying, well, there's another bed here, another bed there, then what? We'll fill up all the beds and then we'll open things back up. We can't do that. That's not a smart strategy. That's not a sustainable strategy. We are going to have to stay home until we bring the hospitalization rate down to 10, 20% of its peak like they've done elsewhere. There's no shortcuts. We're not any different than other communities in that sense, in how our virus impacts us. And so we have to do that. And then we have to follow what we learned from other communities, reopen in a way that is smarter, that's more sustainable, that takes lessons from elsewhere. Now we have those lessons and then move forward. But I think it's very dangerous. It's very sad. The folks that are out there with wishful thinking and kind of thinking that if we just pretend like we're not in a crisis situation, that it'll go away. And the best I can do is be very clear with the community. What we need to be doing right now is staying home. And I recognize it's harder to process that when it's not a requirement, but understand my hands are tied and I'm advocating as hard as I can for additional options to where we can make this enforceable.
And that was my next question. Have there been any more conversations with Governor Abbott? Have you requested the ability to put some authority behind this and actually require folks to stay home and go back to what we were doing before during the months of March and April? Have you talked to him about the possibility of letting you do that?
We have been in touch about that. That was the big conversation all along, especially last week. Now, the governor's taken some steps which are great and they're necessary, and making sure that the bars are closed and, trying to reduce occupancy at the restaurants. My fear is we don't have any proof that alone will do it. There is no evidence from a community that was on the verge of disaster and they put the restaurants at 50% capacity and suddenly everything was fine. The only thing we know works is a stay-home order, and anything short of that is a gamble on our own people. We can't just wait and see if it works, and if it doesn't, we're we've lost. So that's been the ask. I'm grateful for the steps that are being taken, that he is allowing, but I continue to push for the ability to have a stay-home order. I know we are going to have an enforceable one, and the question is, are we just going to wait until we have those images of nurses and doctors having to come in from out of town, of beds in hallways, of beds having to be repurposed? That's not the goal. We have to remember also just the value of human life. Is, since when did we decide that we want to fill out these hospital beds just so that somebody has a bed to die in? And the point is not to fill them. It's to be a community that is resilient and that can be sustainable for the long haul.
Do you sense that the governor can be open to giving you that authority if things continue to worsen, or are you hearing a firm, we're not going there yet? I've heard him say repeatedly this shutting down Texas again would be a last resort. Do you think he's open to that?
I think I can venture just as much as you can into what he's thinking, but I know what we need right now is we don't have time for wishful thinking. We don't have time for strategies that we don't know work, and it's just not right to gamble with people's lives in that way. So I'm going to continue pushing for this, and in the meantime, I'm calling on the community to do their part. This is the only way we can get through this without a bigger crisis. It is the only way we can put our economy back on track. If we see other communities, they had one peak, they had one shutdown. The ones that were smart about it are reopening in a sustainable fashion. They're not seeing the increase we're seeing. And now we're putting ourselves in a position where we're having to shut things back down. So now we're going to have 2 hits to the economy. And if we don't get smart right now, we'll set ourselves up for 3. So that, if you want to look at it from just a pure number standpoint, it doesn't make sense. But we also need to remember the human standpoint, where we are different from other communities. We're compassionate. We work together. We celebrate the unity of this community. And it's important for us to remember that heart of who we are in Harris County, and that sometimes we have to buckle down and make uncomfortable decisions, staying home, save for essential activities, if we want to get through this and put our community in a place to succeed. We're smart, we're tough, and we have to remember that. And but I don't want to put it all on the community. I know that it's harder when there isn't a requirement, and I think we saw it with the face coverings order, right? When we had an enforcement provision, not that the goal is to use it and fine everybody. I think with the stay home order, with the bars and restaurants order, the first one, I don't think we issued a single fine, but just having that there to where law enforcement could go and educate, that made a big difference. And once the enforcement provision was removed from the face covering order, all of a sudden people just, we've all been in a society where things that really are important, that need to be done, they are required. And so that's why I keep asking for that authority.
I'm curious to get your take and your thoughts on how the Texas Medical Center has sort of adjusted how they're reporting hospital capacity, ICU numbers in the last few days. They hadn't posted anything until late yesterday evening, and it's a sort of a new format with what they're releasing. They say it's more easily understood and accessible to the public. I'm curious your take on the information they're now providing in the change.
Look, I focus on transparency, on being very clear when we communicate with the public. When I communicate with the public, I'm not mincing words. I'm not trying to make things confusing. Just for the sake of general best practices from an academic standpoint, from a data standpoint, you don't want to put out a number and change it halfway through. You don't want to put out labels and modify them halfway through, or change definitions halfway through. So I'm very alarmed by that. I disagree with that. It took me a good 45 minutes with my team to make sense of everything that was being said. I don't expect residents have the time, and I can tell you I still have many more questions, because the initial data is data that we were also working off of, that we had our own projections for. That data covers a 9-county region, so we've had to go pull the data for just Harris County and do our calculations with that. And we checked and double checked and triple checked with the TMC, with the regional SETRAC, to make sure our numbers are right. So the timing is suspect. I find it very, very problematic. I said I'm not on board. We do not need to be misleading people. Right now, the message has to be, we are headed toward an unsustainable place with our hospitals, and folks need to stay home. And this message ultimately weakens our community's ability to succeed when the message is being diluted, and when numbers and projections and definitions are being changed halfway through the game, halfway through the battle. The bigger picture, though, we have to remember, the goal is not to have doctors and nurses that we're bringing in from out of town. The goal is not to have basic general population beds that we need for dialysis patients and heart attacks and strokes and pregnant women who need to give birth turned into ICU beds. The goal is not to see how much room we can make for people to go and be there and die in a hospital bed. That is not the point of any of this. And so, and if we want to be callous about it, and if we want to just look at the numbers, and then think about it, you're going to fill up all those beds, take it to the very edge. Okay, surprise, here's some other beds that nobody had heard about. And then what? Then we'll have bars again. Then we'll go back to normal. It's not logical, and it's misleading for the community.
A couple poll questions from other stations in town. KPRC is asking, will the mask mandate be extended beyond June 30th?
The mask mandate is pegged to our disaster declaration. And you have to remember, the disaster declaration, I am only able to extend with the approval of the Harris County Commissioner's Court. So we have Commissioner's Court tomorrow. I will be requesting an extension on the disaster declaration. And if I'm granted that extension from my colleagues, then I do plan to extend the requirement for businesses to require masks from their employees and their patrons.
This question from Fox. We've been told test kit numbers are currently limited to avoid overwhelming our labs and thus delaying results. What is being done to increase our capacity to handle a higher test volume?
I've been in touch with the federal government on this. I spoke with the CDC director just on Friday, working with Governor Abbott on this as well. They've been incredibly supportive to see how we can get faster turnaround times, faster report back times on testing. Some of these sites were not getting results back for many days, up to 9. That doesn't help us with contact tracing, doesn't help the community. And it's just a matter of operations, logistics, the way the labs report back. So we're working on all of it. But these are the kinds of things, if you'll remember, when we first had to issue a stay-home order, and there was just general due diligence that we had to do before we reopen again, making sure that the contact tracing operation is just as efficient as it can be, and things like these. So this is the kind of thing we're working on, preparing for the long haul, right? Preparing for after we manage to make it through this crisis point. Right now, the number one focus needs to be the extent to which those hospitalizations are increasing, and the fact that we need a stay-home order. We need people to stay home if we want to get past this. We want the economy to be back on track.
Second question from Fox. What evidence have we seen so far to support the need for masks? Some are noting that the World Health Organization only recommends masks for asymptomatic people if they are caring directly for someone with COVID symptoms.
We know that masks help folks from spreading the virus. So it's not about you, right? Unless you're wearing an N95 that's been fitted. The mask is not meant to protect you, the wearer, but to protect other people from you if you have the virus and you're out and about. And that's very important. It helps with transmission. A lot of folks don't know, right, that they have the virus, and they do. They may not know that they've been exposed to someone with the virus, and they have been exposed. I do not believe that face coverings are going to solve all our problems, right? That if we just get everybody to wear one, we don't need to stay home anymore. We've seen in some Asian countries, for example, that they're still going about their lives, but they wear face coverings. And we've studied that. We've studied other countries. We've studied other states. What we learn is other countries is really like apples and oranges, because yes, everybody wears face coverings, but also, they require people to download an app. They require people to get tested. They do some geolocating steps that we would never do here because they would violate our civil liberties. And so masks are necessary. They're important. They're a tool, and it behooves us to use every single tool at our disposal. They will not by themselves solve the problem, but we better use it. And we can learn from other states. Once we get through this, people stay home, we bring down the curve to 10, 20% of peak, and then we look at reopening. Then we can see, okay, the states where they have, restaurants open and they require masks, how are they doing? This is all something that we're all learning from, that the scientists are all continuing to study. But what we can't do is sort of cover our ears, put our head in the sand to the data, and pretend like somehow the virus behaves differently here, pretend like somehow this curve is going to flatten itself without us taking drastic steps.
From KTRK, are you satisfied that the TABC will do enough to keep people out of problem establishments? There's videos, obviously, I'm sure you've seen of over the weekend, several nightclubs in town just packed. So do you believe they will be doing enough to keep people out?
We'll see it. It's on all of us, and I do call on those business owners to do their part. Right now, folks should be home, save for essential activities, and it's going to be even worse. The same business owners, the few that are trying to flaunt these regulations, they're the same ones that are going to have more and more trouble reopening, operating, if things continue this way, and then we have to shut down a third time. We have a crisis here. And so we all have a role to play in this. We have, are in touch with TABC. We also have our folks going out there. So we have those enforcement provisions, and law enforcement will use them if need be. But as always, education has always been first. And the idea is not to be seeing how many fines we'll collect. We need everybody's cooperation. What I ask for, though, is to focus on the big picture, and that is just bars shut down are not going to flatten this curve. There is not an example of a community where they were, this close to hitting hospital capacity, where they had an acceleration in their hospital capacity that wasn't slowing down, and they shut down bars and they put restaurants at 50% capacity, and it worked. There's not that example. And doing experiments on our own people right now is just wrong.
I have three last questions for you from our pool for Spanish stations. First question from Telemundo. ¿Cómo se siente y cuál fue su reacción al saber que había estado en contacto con una persona positiva del virus?
En este momento me siento muy bien, no tengo ningún síntoma. Obviamente más difícil hacer todo esto de casa, pero seguimos trabajando. He recibido bastantes mensajes de personas que me dicen que les alegra que esté descansando, y pues la verdad es que no estoy descansando, estamos todavía trabajando bastante. En cuanto al saber que fui expuesta al virus, pues me sorprendió saber que alguien que trabaja para mí ha salido positivo con el virus, pero no me extraña, ya que todos nosotros somos vulnerables a este virus. Hay muchas personas en la misma posición en la cual me encuentro yo, que o han salido positivos o han tenido contacto con alguien que haya salido positivo. Entonces, es por eso que tenemos que seguir tomando precauciones. En este momento es quedarse en casa, salvo actividades esenciales, porque esto va para peor. Si no trabajamos juntos, no se va a mejorar sola la situación.
¿Qué opina de los centros nocturnos que decidieron operar este fin de semana, y cuál es su mensaje también a quienes deciden ir a estos negocios?
Es triste, la verdad, ver que estos dueños de centros nocturnos, de negocios, no les preocupe la salud de la comunidad. Y tenemos herramientas ya para que si no siguen esos requerimientos pueden perder su licencia, pueden recibir una multa cada día que estén en violación. Entonces, no se va a tolerar, pero realmente el tema no es ir y mandar la policía a todos lados, el tema es todos colaborar. Y si estos establecimientos no colaboran, son los mismos que se van a encontrar en problemas económicos cuando haya que cerrar una tercera vez o seguir en este tipo de crisis. Entonces, es hora de trabajar todos juntos y a esos dueños les pido que colaboren, que trabajen con la comunidad, porque esto nos afecta a todos.
En términos de pruebas, ¿se está trabajando para aumentar el monto de pruebas disponibles?
Estamos trabajando para maximizar el número de pruebas. Estoy en contacto con el director de la CDC. Estamos trabajando con el Estado, con el gobernador en eso. Les hemos pedido más pruebas. Les hemos pedido también ayuda en que el tiempo que tarda regresar el resultado de cada prueba, que ese tiempo se acorte en este momento. Hay veces que se van 9 días desde que la prueba se hace hasta que recibimos nosotros el resultado. Entonces, eso es muy difícil para poder hacer el trabajo de rastrear, para poder dar resultado a las personas. Estamos trabajando en eso, pero por ahora lo más importante es el quedarse en casa. Estas pruebas, esas estrategias de rastreamiento, todo eso se vuelve primordial cuando no estemos en un momento de crisis, pero ahorita ya eso se salió de control. Entonces tenemos que permanecer en casa, aplanar esa curva, bajarla a 10-20% del pico que estamos ya ahora alcanzando y después de ahí estar preparados con todas estas estrategias y capacidad antes de reabrir para que no volvamos a cometer el mismo error que se cometió cuando el Estado abrió demasiado rápidamente.
Judge, anything else that we didn't ask you in Spanish or English that you think is important for folks to know that you want to get across?
Yeah, well, early voting is going on right now. And I know we've worked, and the Harris County clerk has worked to expand hours, to expand locations, and most importantly, to make voting as safe as we can during these circumstances. We fought for everybody to have a vote by mail ballot sent to them so that they could be safer. Unfortunately, we lost that fight. Everybody over 65, at least, we've been able to send a mail-in ballot to, and everybody else, you know, voting is an essential activity, and we've done everything to try and make it as safe as possible. It's a difficult situation for folks having to choose between health and between their constitutional rights, between their rights as citizens to vote. But I do want to make sure that folks know that it is early voting for the runoff elections.
Alrighty. We really appreciate your time, and we hope you continue to feel good, and we see you in person soon. Thank you.
Yeah. All right. Thank you.
Thank you so much.